I'm a nutrition epidemiologist and economist working on global nutrition at the University of North Carolina, Chapel Hill. I want to talk today about marketing, but I want to begin by reminding us that millions of children in the US and globally are consuming far too much ultra-processed and unhealthy foods and non-alcoholic beverages laden with unhealthy saturated fats, sugar, and salt. And there are devastating consequences of this for their health and development. In the US today, we have children and adolescents with diabetes, something we didn't see until people were 40 or 50 decades ago. We have diabetes, hypertension among children. By the time they're young adults, we have heart disease growing in proportions. We have kidney disease. We have early disability. We're the highest country in the world in terms of days of disability while we're still healthy and living. And this all relates to our diets. But in my experience, one of the major causes of this unhealthy diet intake is the marketing of unhealthy foods. It's pervasive. It includes our digital media for children, such as TikTok, Instagram, Facebook. It includes all other kinds of media, be they TV, movie placements, print, advertisements at sporting events, and so forth. It's immense. And what you need to understand is the billions of dollars every major global food company that produces these unhealthy, ultra-processed foods has put into creating a digital database on your child and your family. So they know exactly what your child wants to hear, what kind of foods to push, how to do it, what kind of games or other things they like. And it focuses exactly on them. I was involved indirectly with colleagues who were working at the FTC in the 1970s, which was the only attempt where our government really started to put together a legislative push and a regulatory push on the marketing. The FT's Federal Trade Commission at that point produced a huge volume and was ready to begin to push it when the food industry spent tens of millions of dollars to get their congressmen and senators to push against that regulation and stop the FTC from implementing it. That's the last chance attempt we've really made. We've made our schools healthier. The school ban unhealthy marketing and don't sell for children sugary beverages and diet beverages in the schools. And this is really important because the foods that our children eat, the nutrients they take in, if they're super sweet, it changes their taste forever. And they always will want to consume excessive sweetness and excessive sugar, and which is really what's fueling our diabetic epidemic among all ages in America today. Now, in my experience, I've been working with countries elsewhere. Chile, a high-income country in Latin America, other countries in Latin America and Africa that are banning these marketing. In Chile, we had almost a complete reduction in exposure for young children when we banned all media from 6 a.m. to 10 p.m. Obviously, some adolescents stayed up later, and we wish we had gone up to 6 a.m. to midnight. But the point is that we reduced it so much that we had young children telling their mothers that from what they had seen in schools and elsewhere, they wanted to eat foods without these unhealthy warning labels. They wanted to eat healthy foods and real foods that were not ultra processed. It was an amazing set of experiences, and we've seen a drop in Chile among child consumption of about a third in their sugar intake, about more than that in their sodium intake, and a 16 to 18% reduction in their saturated fat intake. These are enormous reductions just from that marketing ban. And we need you in this country to start to think about that. We need you to talk to your state legislators, to talk particularly to your federal congressmen and senators, push them to get rid of the marketing for children, push them to get the FTC to go back and do the rigorous studies and work to ban unhealthy food marketing to our children. It's killing them and it's killing our future generations.